Good evening, everybody. We're going to start the meeting of the Community Relations Committee of Health and Hospitals. I'm sorry for the delay, but we have several of our speakers in transit, but we have backups who are here who are in an excellent position to speak for the various hospitals that will be reporting tonight. So I hereby call to order the meeting of the Community Relations Committee of the Board of Directors of the New York City Health and Hospitals for Tuesday, September the 12th, 2023. Please note for the record, Senior Vice President Deborah Brown is here representing Dr. Katz in a voting capacity. And we have our board members, Sally Hernandez Pinheiro and Jackie Rowe Adams, who are here. I do not see any other board members who are here. And of course, I'm Robert Nolan, chair of this committee, and as board members, we constitute a quorum. I now call a motion to adopt the minutes of our last meeting, which was May 2nd, 2023. I'm going to poll each member for his or for her vote and concerns. Sally, how do you vote on the minutes?
I vote in favor of the minutes.
In favor. Jackie, how do you vote on the minutes?
Ditto.
Okay. And you have a vote,
Aye.
3 votes in
Yes.
favor, 4 in favor. So the minutes carry with a unanimous vote. Thank you very much. Scheduled to present this evening, as you know, are Health and Hospitals, various hospitals, Kohler, Elmhurst, McKinney, Jacoby, and North Central Bronx. The president, Dr. Katz, his report is included in the materials. Let us know if you have any questions, and we will coordinate a response for you. Now we're going to hear from the 5 facilities presenting their annual reports. Each presentation is allotted 5 minutes, and we are grateful for the work that went into preparing them. Thank you in advance to all of our speakers and for the time and commitment to our system. So I call first upon Mrs. Verna Fitzpatrick from Kohler. Mrs. Fitzpatrick, thank you very much for attending. Please begin your report.
Okay, thank you. Nice to be here. And I have to introduce myself. I was recently elected president of the board, the Community Advisory Board for Kohler Hospital. And I bring greetings from Gladys Dixon. Gladys Dixon, I spoke to her up to yesterday, and she's
give her our
doing
best.
fine.
Yes.
And she coached me on what to do and how to conduct myself. And, you know, she's a pillar of her community and of the board.
Yes.
So I'll be reporting back to her, as you can imagine. And of course, I have Mr. Catullo here with me. So it's my pleasure to be here for the first time. And needless to say, I have a report from Kohler. And I've been a resident of Roosevelt Island for over 40 years. And I've known of Kohler Hospital from many different vantage points. I used to be a New York State Department of Health surveyor. I also was an administrator of another nursing home, and I am very involved in long-term care. So for me, it's a pleasure to represent Kohler and for you to know all of the wonderful things that are happening there. And from the advantage of the residents, the staff, and the community that is very involved and dedicated to the facility. So I believe you have the report, but I can
We
give you
do.
some highlights.
It's been circulated.
Yeah, just some highlights because it's very comprehensive and detailed. So throughout 2022, the COVID vaccination and booster clinics were held for residents and staff, and they continue to be available to those who wish to have them. Visitors are no longer required to present current negative COVID-19 tests before entering the facility. And community outings for the residents have resumed. As you know, the residents are very active on the island, and we see them visiting the local businesses, the local churches, and they're really part of the community in many respects. In terms of the infrastructure, for this year, they installed 507 bedside flat screen TVs for the residents. And a new gym was renovated so that the residents can exercise and keep active.
And who's that lady at that gym?
That looks like somebody. I know. You are prominently featured. But the residents are enjoying it. And as you know, it's well supervised by staff. Whenever they're in there, there's proper supervision. Kohler is planning for an indoor greenhouse to be expanded for activities, especially as the winter comes and it gets colder. We want to make sure that they can do those activities indoors. And the library has recently, they're working on refurbishing and it should be completed by, in a few months. In terms of the infrastructure of the building, it's a very old building. It was built in 1952. So there's constant work that needs to be done to keep it up to par, and needless to say, to ensure the safety of all staff, residents, visitors, everyone. Work continues on replacing Kohler existing emergency generator, and we're hoping that it will be completed by the end of this calendar year. In terms of resident safety and satisfaction, one of the things that we're currently experiencing is the Plane Tree International group. They're at Kohler as we speak, conducting a review of the facility since Kohler was designated as a pilot for this type of a program. And hopefully, I know Jovi is here with us, and they're reviewing all of the aspects of the building. And I'm hoping that results will be positive. A Care Experience Committee has been established, and they work diligently to improve resident satisfaction and their experiences in the building. And satisfaction reports, satisfaction surveys have been very positive, and the residents have indicated that they are more and more satisfied with the services as rendered. Meal service. Do we know food is always a big issue, right? And one of the things that we are very fortunate to have is a very involved staff, with the system chef being very involved in providing sample meals and tasting foods so that the residents can enjoy their meals in the building to the best of our abilities. Laundry services, a special group has been designated to work diligently on improving the quality of laundry linen and towels. And that initiative has begun and is proven to be successful.
Excuse me, Ms. Fitzpatrick, you have one more minute.
Oh, I only have one more minute. Well, we're close, almost done.
Excuse me, let me just say, we started 15 minutes late because we're waiting for people. So there were 5, and usually it's 5 minutes each. So I need to watch the clock, because if this meeting doesn't end at 5:59, I'm going to get fired.
Oh, no problem. I'm fine with that.
I see that.
But one of the highlights that I have to mention is that Kohler Hospital has been given a number 5 rating by Newsweek as the best nursing home in New York State. So I think that deserves a big hand.
Yes, it certainly does.
And Kohler continues to have a 5-star rating as it relates to the quality measures from federal and state governing bodies. Challenges is an old building. We continue to work on it, and needless to say, it's not comparable to any other institution, nursing home or hospital. Staffing has always been an issue, but the facility continues to fill the necessary slots to ensure the safety and quality of care to the residents. And I think I'm done.
Thank you very much.
Thank you.
Congratulate you and everybody who works at Kohler for the outstanding job that you've done to achieve the rankings that you have across the country. You make us very, very proud of the hard work you do there, both for the city system as well as for people who want to go to Kohler. You'll be able to tell them the story that you've been able to work so hard to achieve. So I don't have personally any questions. I'll ask my colleagues if they have any questions for Kohler.
So I don't have any questions, but what I want to say is Sally and I'm going to speak for Sally too, because we had a bunch of fun. And that's what it's about. When we go out to see these hospitals and visit, we're not looking for the bad things. We're looking for some good stuff. So what we do is we take care of business, but we still have fun. And we had fun, and as you see, I was in that chair showing off because Raphael pumped me up. For those that don't know Raphael is the new nursing home director? Public Affairs. But he pumped me up. So I was showing off, but the next day I had pains and aches. And so I just want to say, keep up the good work.
Thank you.
And thank you. And as I said, we had a nice time, long walk. We thought we was going to walk forever.
Long hallways,
Thank you.
long hallways.
Yeah.
Did you have any questions?
Just to say welcome, we're delighted to work with you, and we'll be in the next round of the meeting. And also just to say, Stephen is lucky or unlucky enough to spend a lot of time working with me and with my office, and we could not ask for a better partner. So everyone's in good hands.
Thanks to Ms. Dixon and Mr. Catullo, and thank you so much for your presentation.
Okay.
We're going to move on, and I'm going to recognize Mr. Luisang Tamang from Elmhurst Hospital. Welcome, Mr. Tamang. The floor is yours.
Good evening, everyone. This is Luis Sang Tamang, the CAP chair from Elmhurst Hospital.
Please speak up.
This is Luis Sang Tamang, the CAP chair from Elmhurst
Gotcha.
Hospital. In regard to the CRC report from Elmhurst Hospital, Elmhurst Hospital is a 545-bed community hospital and level 1 trauma center. Last year, we had close to 700,000 ambulatory care visits and over 130 emergency room visits. And Queensboro, as the world borough, we provide over 125 language translation services at the hospital. The Elmhurst Hospital recently received recognition from U.S. News and World Report as a high-performing hospital, and we're also ranked nationally as one of the best hospitals overall in the United States. Elmhurst has also received Nursing Excellence Awards from the American Association of Critical Care Nursing for providing top quality care to patients. American Heart Association has been recognizing Elmhurst Hospital for several years for providing life-saving care for stroke, diabetes, and heart attack patients. We have just been recognized for Planetary International for excellence in patient-centered care. And we also have been successful to fund $18.59 million from our elected officials for the projects for fiscal year 2024. And the projects include surgical subspecialties funding, portable X-ray machine, mother-baby unit relocation, cardiac cath lab replacement, additional MRI chute, and NICU relocation. During the COVID-19 crisis, Elmhurst has served as a beacon of hope and healing for our community. Throughout the pandemic, the hospital has vaccinated over 135,000 people in the community and performed well over 225,000 COVID-19 tests. We continue to support our patients by performing tests and vaccinations in our clinics. Elmhurst Community Outreach Team works to promote wellness and health equity. In the past year, we have reached over 28,000 people through community health events in Central and Western Queens. And this is the end of the report. And before that, I would like to acknowledge and introduce my colleagues from Elmhurst Hospital. We have the membership committee chair, Helen Shares. This is there.
Thank you very much for coming.
And Dras Punjabi, the vice president of the CAB.
Thank you for coming.
The Ken Chong is here, the liaison from Elmhurst Hospital. And Yadav Bastola, the board member of the CAB. Thank you.
Thank you very much, Mr. Pong. Are there any questions from any of our board members for Elmhurst? Then please, yeah, it's a terrific presentation. Please thank your CEO, our dear former colleague, Helen Ortega Landaverde. Tell her when I call her next, I'm going to be asking her about the signature of hers that appears on the last page, which if I did that, Our Lady of Solace, the nuns would put F down on my report card. But, you know, whatever this version is of a signature, I will discuss that with her privately. If you have a good sense of humor like Helen does, she'll laugh. Thank you very much, and thank you for your presentation.
Not a question, but
Yes.
I just wanted to recognize that Helen is here as the former council member that used to represent.
Where is Helen?
Is
Okay.
It's so good that you're here.
used to be here, but.
Okay. I have no idea who that is. Okay, we're going to move on. I'm going to call upon McKinney. I got the watch here, and that's what I'm bound by, and we're a couple of minutes late. But we're moving on to McKinney, and we'll have a presentation from the CEO, David Weinstein. Mr. Weinstein,
Hi.
thank you so much. It's
Good
good to
evening.
see you again.
Hello. I am speaking on behalf of Deborah Tyndale, who is our cab chair. I can only assure you, I left super extra early. The traffic getting out of Brooklyn was.
It's a bad day out there with traffic.
So I am speaking on her behalf. It's my pleasure to speak on her behalf. I wanted to thank you for the opportunity to present. The last time, I'm trying to remember when we presented, was probably remote, and it's good to have everybody face to face. Just for everyone's knowledge, McKinney, which is pretty much in East Flatbush, Brooklyn, right across the street from Kings County Hospital, is a 320-bed nursing home. It runs about 98 to 99% occupied for the most part. And we also have about 400, a little over 400 employees that represent the staff there. And we also have a daycare program in Neponset, which is Queens. Some of you may be familiar with it. It's on the peninsula, and it serves about up to 50 registrants a day, people that otherwise need health care, that would otherwise warrant them into a nursing home. It's an alternative to nursing home placement. So they go there for medical model, which is medication management, and physical and occupational therapy and dietary guidance, some meal planning, and maintenance of medications. So that program was shut down for 3 years during the COVID period, from March 20 till about August of 22. So last month we just celebrated the first year anniversary of it reopening. So we're really proud of that. So following our infrastructure, what's gone on in the past couple of years, we've been really happy and grateful that new call bells went in, which were desperately needed. With that went in new Hill-Rom beds. With the Hill-Rom beds, gave new stands, new overbed tables. We got flats. We're in the process of installing flat screens TVs, similar to what Kohler's doing, to enhance the quality of stay for the residents. We've also done, in the works is enhanced cameras for better surveillance, shower rooms and pantries, cooling projects for the IT closets, and a fire alarm system. Those are the programs that need to be started up. But we're thrilled that the overbed tables, the new nursing conference room, H3 Wellness, enhanced dining, and the energy efficiency projects have taken off. As it relates to residents and staff and safety satisfaction, we have a multitude. I don't have to read all of them. It's in your report. We're proud of having downstate medical students join our residents. Baby doctors coming in and doing some assessments from afar. We've had a resident steel band, which took months of practice, and they performed at Christmas time. The residents grow their own gardens outside in wheelchair gardens. They actually make their own salad and have a salad day. We continue with our care experience to facilitate the provision of person-centered care, really to improve how we relate to our residents. You'll see a picture of my director of nursing, Miss Ann White Akanui, and sitting down looking rather exhausted is me, dressed up as Mr. and Mrs. Santa Claus. And we have a lot of fun with that every year for both the residents and the staff. In terms of issues impacting the community, we are very proud that we also are listed in Newsweek as in the top 5% of the nursing homes for the state of New York, which is a nice place to be. We try harder, but we're in the top 5%. And we're also proud that we moved from 4 stars in 22 to 5 stars in 23 following successful surveys.
Oh, that's terrific. It's great progress.
Challenges, like you've heard before, aging plant. We need a lot of facelift. The building's solid. It was built well. It's in good repair, but it's just dated. and it looks, old, and I think.
If you could request capital money from either a borough president, the council, or the administration, what one project would you want to see funded, this year?
Well, this year it's fire alarms, because still have to go with what's the life safety issues first. We have a new roof, we have new elevators, we did a
How
lot
much
of.
are we talking about when it comes to fire alarms?
Oh my gosh, I think it was.
Approximately.
I think it's in the order of $5 million or 7 million.
Oh, $5 million.
Or 12. It's
Not-
5,
not-
7 or
not
12. So I don't know if we asked for 5 and it's really
$5 million.
between 5 and 12. I can get you that number tomorrow.
The mayor, the borough president, who's been very generous, and the various council members should get you in the range in a couple of years.
Yes.
But if that is your number one priority, I'll certainly remember that.
And then we need about $30 million to renovate the entire building.
Now,
top to
Mr.
bottom.
Weinstein. Now you're getting into big money, but that's what I asked you for, and I appreciate hearing that.
And if you want to have a really fun time, even more fun than Kohler, come to our International Day, which is scheduled for October, I think, 5th. The staff get together from all our native countries, and they put together food and cultural trinkets from each of their countries, and everyone just walks around all afternoon, stuffing their faces, listening to music, and hearing our staff promote their own cultures, and it's very important for us.
Just invite us.
Thank you very much.
I will. Thank you very much for your time. Did Miss Tinsdale show up? She did. I thought I saw somebody walk in.
Please stand.
I know, we took the bullet for you, and I took the bullet for you. I hope you enjoyed the report. I don't know if there's anything more you want to say or add.
Ms. Tyndall, would you like to add something?
This is Miss Tyndale. She's our chair. Okay.
So if you have patients and family members, you have to make sure that you send them.
At the beginning, when Mr. Weinstein was recognized?
I was,
Oh, okay, because I wanted to make sure that I didn't make a mistake by missing you at the begining.
No.
It's a tough day getting around.
Oh, really?
We still have people on the
There's no
road
question.
trying to get here, and
I sort of walked
I
in. I'm like,
appreciate you
oh.
being here. And we've heard a terrific report from McKinney, and we've also heard some very ambitious capital projects, but then that's what I asked you. And you very honestly told me exactly, and I had to tell you, I still am shocked at the cost of $5 million for that. But of course, those of you who are CEOs are not shocked, because this is what you live with day and night, so.
I think it's more like 12. That's why.
Depends who's funding it. That could be the entire borough president's budget for the borough of the Bronx and for New York County.
It's very complicated.
Brooklyn,
Tie in with
which
everything.
gets to maybe 60 million in a year, if they get 30 in the other boroughs,
Oh.
but the Brooklyn Borough president has gone out of his way to really give an enormous amount of money to the hospitals in his county. So I want to acknowledge him. He's shown generosity that is above and beyond what you often see from elected officials. But thank you for, now, are there any questions?
I have
Yes,
a
go ahead,
question.
Jackie.
Daycare. So the residents that's in the nursing home, they're the ones who go to the daycare, or is it a new recruit?
No, it's not someone from a nursing home to a daycare. It's people living in the community, living in their own apartments, living in their own homes, come to this daycare program up to 5 days a week from like 9 in the morning till 3 in the afternoon to give their caregiver, to give their spouse a break so they can go out and do shopping or get some rest.
Okay.
It's meant to delay or just to delay premature institutionalization of a nursing home.
Oh, okay.
That's its intention from years ago. Unfortunately, reimbursement has really changed drastically, and it's hard to get cases approved because of managed care. Everyone who's in the community has to be enrolled in a managed Medicaid program, and the Medicaid programs, which are capitated, are not fans of an expensive medical model program, which is upwards of $160 a day, versus a social model, which is more like $50 a day, and that's really just adult sitting with nutritional meals. So there's a difference. We're proud of our program, but it struggles financially, make no mistake, and leadership is aware of that.
Sounds
Thank you.
good, yeah.
Jackie. Sally, do you have any questions? Or
Thank you.
Deborah, do you have any questions?
Although you didn't hear me say that $30 million is a bargain to renovate a building. I don't have it, otherwise I'd give it to you.
The only thing I would say, and David referenced this in the report, but also Raphael, has put together a video of the carnival from
Oh.
just before Labor Day, I was going to say Election Day. And it's just wonderful. And so if people haven't seen it, I highly recommend it. It was out on our social media. It's just lovely. So congratulations on that.
Very good.
Well, I'd like to thank you very much for your presentation. Thank you, Ms. Tyndall, for being here, and Mr. Weinstein for bringing us up to date on what's going on at McKinney. Good luck to you. Good luck. I hope you have a very, very successful international festival. We are down to the final two hospitals. I now look at my watch, and we have 22 minutes left, so I'm a bit more comfortable that we're going to make it in under the wire. As we're waiting to see if Joe Ithia, who I've known for 43 years, I really had a great introduction for my buddy who was coming to my committee hearing, that I could really do a number on him, but I would never do that. But we spoke today, and he was looking forward to it, and we've been friends since 1979 and continue to be friends. And he is the newly elected chair of the advisory board at North Central Bronx, the chair at, I know I'm taking Mr. Mastromano's time here, but I'm giving Joe some time. Judith Benitez is the president or the chair at Jacobi Hospital. And in her absence, I understand they're both in the same vehicle. Have they been cited? Do we have any updates? This is like Santa on Christmas Eve. No update. So there's somewhere on the East River Drive in Carland, which we all know about. And if this meeting was held prior to Labor Day, they would have been here an hour ago. And you should know from having worked with Joe when he was chief of staff to Borough President Freddie Ferrer, and I was budget director, that if the meeting is at 4 o'clock, Joe was there at 3. I would be there at like 10 to 4. But Joe would be there at 3, and he'd be helping out moving chairs around and tables around, because Joe didn't just act as chief of staff. He was part of the maintenance crew, the pickup crew, the sanitation. He was the one who told everybody the most important job here is putting the bags out so we can clean up all this garbage when everybody leaves. So he would always put himself in charge of sanitation at the end, and they got all of us who were managers who didn't want to do that. Hey, get over here, grab a bag and start cleaning up. So those are fond memories. I suspect that while you are in the midst of speaking, Mr. Mastromano, that we will have an appearance by either Charmaine Graham or Joe Ithia, but in their absence, I thank you very much for being here. Congratulate you on a very successful event yesterday at Jacobi Medical Center, where once again, for more than a decade, you've led the community and with all the elected officials there, and remembering the men and women and children who lost their lives on September 11th. And I understand even the Lieutenant Governor showed up this year. So it goes to show you that that particular event is one of the most important events, at least in Bronx County. And I've spoken there at least almost 8 or 10 years. They've been kind enough to let me speak. And it's important to give that community the opportunity to come and see that tablet, which has the name of more than 150 Bronxites who've lost their lives on that day and in subsequent days. But with that, I'd like to thank Mr. Mastromano for being here and ask you to begin your presentation for Jacobi Hospital.
Sure, so thank you. I'm sorry that neither Charmaine or Joe's here, though Joe would take a lot longer than his 5 minutes, so you'll be grateful that I'm and I will tell him that. I owe him from yesterday. So reminder to the other cabs, Jacobi and North Central Bronx are really a single hospital legally with 2 campuses. We're the only ones that do that. But we strategically left the Community Advisory Board separate because they're 2 different communities that are served. So the input is very, very important. They continue to be collaborative on their own. They work very, very closely together. Yesterday's 9/11 remembrance is really put on by them. They run it. We support them to do it. So I just want to, I won't do them justice to go through. We'll go to the next slide. A couple of highlights I just want to do. Can you go to accomplishments? Perfect. So the 2 for Jacobi that are most outstanding for us is Jacobi was the first public hospital in the United States to receive American College of Surgeons quality verification. So we were one of 5 in New York State, the only public hospital in the state as well. That we were in the likes of Columbia, Cornell, and
Congratulations.
Jacobi got it, so we were good. Mr. Catullo is going through it, so we just received our Plaintree designation of silver.
We were just shy of gold. We look forward in October to getting our official package from Plaintree. And as soon as that happens, we will start North Central Bronx on their journey for Plaintree designation as well. Next slide. So everybody has infrastructure needs. It doesn't change. We're aging facilities. Jacoby's been very fortunate. We've gotten a lot of funding recently. We've been upgrading the HVAC units. We're putting in a wellness center based on some legislative funds that we're doing. We really want to teach the community how to cook, how to deal with their diabetes, their obesity, as well as some public gym work that we're looking to do.
And I understand that that's slated to be open perhaps as early as January.
Yeah, it keeps getting delayed, but we're getting closer. The
Now, is
supply
this from
chain is-
Assemblyman Jonai or Councilmember Jonai? Which is a
Assemblyman
state-
Jonai.
So that was when he was in the state legislature, okay.
Right.
Terrific,
They secured additional funds when this is done that will open the kitchen and everything else. It's really going to be quite beautiful.
terrific. And which building will that be in?
It's in Building 4 in the basement.
For all the years I'm living nearby, where is Building 4?
The nurse's residence.
Oh, well, that's what everybody knows it as.
So while
When I'm
leave you where
sitting
you're
in my living room on my easy chair and the trees are cut properly, I see the nurse's residence. I see the windows there. So I actually see the building every morning.
Is
But
that
when
a
the
dig? I
trees
gotta
cover
cut the
it,
trees?
then I can't see the nurse's residence. But this is about the 15th time I've asked, where is Building 4? And embarrassingly been told it's the nurse's residence.
Nurse's residence.
That's okay. I won't ask you again.
That's
Thank you
fine.
very much.
Complaints that come up through patients and patient satisfaction, it primarily, and I'm sure a lot of us deal with it, is its attitude. And we're really addressing it. So Plaintree's helping us. We've seen a steady increase in our press gaming scores as a result. Because Plaintree is more about, it's a person-centered program. It's not just telling people the right thing to say. It's supporting them in what they do every day. And Dr. Katz's kindness campaign that we've launched with his structure is going to really help us address that. So we're very much engaged in doing that. And that's pretty much it for Jacoby. I'll go on to North Central when everybody's ready, unless Joe's.
Well, let me just say, are there any questions for Mr. Mastromano regarding Jacoby's report?
So I have.
Jackie, go right ahead.
So my question, it's not even a question. North Central, first of all, let me say, kudos to Jacoby because we visit Jacoby. It was just really a sight to see on safety and beautification of it. Plus you had my picture up there.
That's
so.
right.
But I want to talk about North Central. So I visit a friend. I have a very good friend that's in there now, and I visited, and that was the first time I've ever been there. So so I want to say, improving Jacoby and building all this stuff up, North Central need a facelift, a little facelift. You agree with that, right? It was kind of dull. I was kind of scared because it was quiet when I went, and I've never been there, and it's small, and you have to find your way. And I realized it was our hospital. And I said, oh, okay, we got to do a facelift here. Little painting, little color, spruce it up. I like happy. So I just want to say, but keep up the good work.
We'll take you to some of the floors that are a little spruced up.
Yeah, okay.
Then come to the
Oh,
Are there any other-
I'm sorry. He said he's getting great service. I have to end on that note.
Oh, good.
Adjourned, I'm done.
Thank you very much for your presentation regarding Jacoby, and please start your presentation regarding North Central Bronx.
So North Central
We are
Bronx-
now at 5:45, and I'm confident that
Done in 2
we'll be
minutes.
able to finish this on time, and that's great. Thank you.
So accomplishments for North Central Bronx. North Central recently got certified by the American College of Emergency Physicians as a geriatric emergency room. They went through a rigorous process. They trained the staff to handle people that are I gotta be careful of my own age now, so, but are there. They know how to handle people more in the geriatric population, and they can link them better to care, and we're really proud of them to do that. They're also, which Jacoby is not certified as, North Central Bronx is the only facility in the Bronx, they're a Gold Safe Sleep Champion. And they really work with the moms and the kids to avoid that, and we're really proud of them. They take a lot of pride in that as well, that they go through. The infrastructure, well, we have a lot of funding that's coming at us, and we're very happy to go through. Part of it is we're trying to align with our correctional health services because they want to put an outposted therapy unit in North Central Bronx on a few of the floors. And as our colleagues there are working through the Bellevue model, then Woodhull, and then North Central will go next, in that is a pretty much total refurbishment of the building. So we're really looking forward to that. We're very excited.
And as I recall, this is the project where persons who are at Rikers Island now can go directly to North Central Bronx and get care and attention as they get at Bellevue.
So no, so Bellevue is forensic unit. It's very different. The outpost of therapeutic units for people that need nursing home type care,
Uh-huh.
and they'll just be based in an acute care facility. It'll be run totally separate.
But
It'll be
it's
secured, it'll be
very
locked.
chronic condition.
Correct. Well, and then we'll provide support to them as they need it, but we're really going to be the landlord of the program.
Okay. And how far away do you think we are from that project being completed?
We're a few years away.
A few years away.
At
Okay,
least.
thank you very much.
How many beds are they supposed to have?
It'll be 100 and change. They're going to take over 3 floors because of the requirements of recreation and some of the space that they need. And it's really, they're going to have their own elevator. It's going to be
Well needed.
well needed. That population needs it, and that community's going to, that facility's going to benefit from some of the infrastructure. So it'll be very good. In the meantime, we're moving on, doing everything else that we need to do.
Thank you.
We're just not waiting to go through. No different than well, slightly different than the other. The employee attitudes are a little bit better at North Central Bronx. NCB tends to rank the highest in the corporation of Press Ganey scores when it comes to that consistently. If we can only figure out how to get some of that over to Jacoby, I'd be thrilled. It just doesn't happen. They are 2 different populations of staff, and we recognize it, but they work hard. They work collaboratively with Jacoby. We actually move patients back and forth almost seamlessly at this point. We're probably moving 15 a day. They become a real outlet for Jacoby. So people have to sit in the emergency room for days. They get to actually go get a bed at North Central Bronx. And and the care's great. I mean, Jackie said it perfectly. There is no difference. The physicians are the same. So the care's identical. But we're going to put them on the journey of Plaintree and really take them to the next level. That'll take us about 2 years to do. We look forward to that. And are there any questions about North Central?
I know they have an amazing mother-baby program. I think they have a doula program as well, do they?
So we don't have a doula program. It's funny you said that because the chair of OBGYN today, apparently an outside company wants to come partner with us. We're going to have a conversation about that. But we allow doulas in, of course, and we have since COVID to
It's a
be
logical
with them.
next step.
Yeah.
Right, yeah.
Absolutely.
Yeah, Jackie, do you have any questions at all?
No, he answered. He said they're gonna do a little, I'm gonna see a little spruce up when
Absolutely.
I go. So that's
Do you
good.
have any questions at all?
Thank you.
Okay, I sit here then at 10 minutes of 6. I want to thank all of you for helping us get through our list of hospitals that we report today. We know there are people still on their way, and that's the way things happen when you're coming down here. I said to the driver on the way down from the Bronx, I said, has any thought been given to moving our central headquarters to Harlem? Because that for me in the East Bronx is a 20-minute drive. And of course, I knew the answer, which I asked you about a couple of years ago, was that fact that, no, we have this headquarters down here where the Dutch first settled in 1624, starting with the Battery and moving up a couple of blocks. I'm not sure how far they got before the English gunships, remember? In 1664, I remember, I was there. 1664, English gunships showed up, and one of their captains wrote in and said, it's time for you to leave. And the British took over, as they've taken over in many places across the world. But, so we literally, I think, are in the area that the Dutch first settled in 1624, but how different things look. I want to really thank the administration for all that they did, because we have beautiful facilities here. But on hearing that, then, I want to thank you all again for participating. I'm going to ask, is there any old business? Is there any new business? Then we are adjourned at 5:51.
This meeting is no longer being recorded.